Dear students, welcome to R.A.T.S, Racing Against Time for Students in Pathology. And our pursuit of Neoplasia shall continue. What are you seeing on the screen? This, of course, is a world-renowned novel by Arthur Haley, The Final Diagnosis. The story runs thus. There are a couple of pathologists in a hospital, a senior person and another junior person. A staff nurse falls sick, has got a swelling around the knee, and a biopsy is taken. One says benign, the other says malignant. So the slides are sent to two different parts of the world, to two different pathologists. After some time, they get the report. One benign and one malignant. So this is the initial biopsy that was taken. Of course, it is a superimposed animation. In spite of all the controversy, the senior pathologist goes in and makes a diagnosis of malignancy, after which they do an amputation. So this is called an above knee amputation. The femur has been removed along with the tumor. Once something like this is done, it is like a playground. You've got a lot of tissue which you people can study in detail. And finally, it turns out to be malignant. And that is the story of the final diagnosis. Hope I had not deviated you too much from the topic, which is the diagnosis of tumor. This is an essay question and a little difficult for the undergraduate students because they do not have that amount of a concept, and the field of interest importance is given in the enclosure. Always make it a habit to write a panel. These are the various subheadings. As I usually tell my students, think of the subheadings. The subheadings will take you to the answer. We may know many a thing, but what will happen is when we miss some subheading, we will be losing that particular mark. So this is the panel of investigation that can be done. Many of them are pathological, some are electron microscopy, genetic, as well as a radio diagnosis. So let us see how we can apply this. As soon as a tissue is obtained from the theater, it can be a biopsy or it can be a larger specimen. It is put in formalin for a process called fixation. These steps you people should know. Then there is a processing. Finally, they put it in wax called as embedding. Tissue sectioning is done and staining is done. So these steps we should know, because sometimes in the viva, strangely, the examiners ask the students what are the steps in tissue processing, which will actually be this. This particular flow diagram I would like you people to kindly remember. So there is a biopsy of the tissue and it is subjected to grossing. Grossing is you dissect the specimen and you give a bit for the processing. The first stage is fixation. Fixation means it prevents the tissue from undergoing autolysis or degeneration. That is under formalin. Then there is alcohol. We have got ascending grades of alcohol which will remove the water, which is called as dehydration. Finally, the alcohol is also removed by a process called clearing, and the substance used is xylene. After this, as I had mentioned earlier, it is put in molten wax or paraffin wax, which is called embedding. We make a tissue block out of it and sections are cut. The cut sections are mounted onto a slide stained with routinely hematoxylin and eosin, and finally reported upon. So this is the process. Earlier, all these steps used to be done manually. We used to change it from container to container, wait for the time, and again proceed. Everything used to be done manually. But here, what we are seeing is an automated tissue processor. So many stations have been mentioned, and so many containers are seen over here. And what happens is there is a timer. All these are well programmed. So after that particular time, there will be a central lever which lifts up the whole thing, and the buckets of specimens are moved to the next container. And after some time, it settles down. So it is called as the motherboard, in which all the timing is completely processed. In fact, this is the most sincere worker in the hospital. Even when we go home at evening, even in the night, you find that this instrument will be continuing, so that in the morning everything is ready for section cutting and staining. So this is called a histokinet, or an automatic tissue processor. Okay, sorry for deviating again. I would like people to kindly go to game. That is gross on microscopy explained. I hope this particular channel is well made use of by the students. Go to game and tell me what you had seen or played. What we are seeing on the screen is a capsule. In this, molten paraffin wax is poured. It is liquid. And the fragments of tissue that we have dissected are put in it. The wax undergoes solidification. We get a block of wax, which is called a wax block or a paraffin block. And this is fixed onto an instrument called the microtome. So the microtome, micro means small and tome means to cut. So this instrument helps us to cut very thin sections of 4 or 5 micron. 1 micron is 1 by thousandth of a millimeter. So 4 by 4 or 5 microns, you can assess what it is. Here I am finding the block, and this is a knife that is used for cutting. And after cutting the sections, they are stained with hematoxylin and eosin, finally examined under the microscope. This is a beautiful Leica microscope, a binocular microscope, under which we see the section. Sometimes it is a laborious process and the patient is on the table. We have to have a rapid diagnosis. More than me, the surgeon. He wants to know whether it is benign or malignant, a tumor or not. So this is one instrument, and it is called a cryostat or a freezing microtome, in which what will happen is there is a block here over here, and the temperature will be quite low. The moment we keep the tissue, it becomes solidified, and this is the station that I am explaining. These are all tissue holders in which the tissue will become solidified with ice, and that is fixed onto the microtome. Sections are being cut. So crudely, it used to be described as a refrigerated microtome. It is useful for making a rapid diagnosis for the demonstration of fat and enzymes, because we are bypassing all the other procedures. Alcohol, for example, so the fat is preserved. Xylene, etc., formalin. So you find that the enzymes are preserved. And sometimes we can use it for immunofluorescence also. Please read this. I taught you this elsewhere also. The cryostat is an instrument, and this is the freezing station. This incidentally is another book of mine. Hopefully you people will be seeing it in the short future. Tips, topics in pathology for students. A small book. Special stains. Sometimes the HNE alone is not sufficient. See, this is a hematoxylin and eosin. In that we have got only two colors, the blue color for the nucleus and the pink color for the cytoplasm. So there is a tumor over here, but we do not know what it is. So we do a special stain. This slide, it shows a special stain with PAS, periodic acid shift. And The tumor cells take up a magenta color because they contain mucin. So it is a mucin secreting adenocarcinoma. So these are some examples of special stains. You people can note them down. PAS, oil red bow for fat, meson-strichrome for connective tissue, reticulin to distinguish between carcinoma and sarcoma. This incidentally is a reticulin stain, and all the black fibers are the reticulin fibers. Van Giesen is a stain for muscle. So some of the special stains have in mind. Bone marrow is another mode of diagnosis, particularly in the case of leukemia, etc., or a lymphoma. We can do a bone marrow aspiration to see whether the bone is involved. Also, it can be done for diagnosing a metastasis. So there's a bone marrow aspiration needle and bone marrow biopsy needle. What is this huge chimney that we are seeing? So it is something that is totally different. This is an electron microscope. And look at the magnification. This is a particular cell that we are seeing. And we are finding some granules within the cytoplasm. We can make various diagnoses. And even on the surface, I'm able to see some kind of cilia. This kind of an appearance can be seen. Electron microscope, several times magnification. And it is done by means of a beam of electrons. Finally, the picture is made onto a computer by means of it. It is well programmed and used for very rare diagnosis and scientific research. Yet another method of making a diagnosis will be the chromosomal study. By karyotyping, we can find out how many chromosomes a person has got, whether they are normal or not. And this is one method of abnormality. There can be a translocation. Part of a chromosomal segment is transferred to another chromosome. And this happens in the case of a Burkitt's lymphoma. Histologically, when we see that, I find some pale areas, and this is called a starry sky pattern. And we will be doing a chromosomal study to confirm the diagnosis. These things we have already explained. Exfoliative cytology, you people must try, don't omit. FNAC we have explained in detail. Blood smear we do for every other case. So these things must be included in your answer. X-ray alone might not be sufficient. Sometimes for breast cancer, we inject a contrast, and by that we'll be making a diagnosis which is called a mammogram. Tumor markers I had already explained in detail, immunohistochemistry and monoclonal antibodies. So look at the panel of investigations that you people can do. Kindly go through the previous classes also so that your entire preparation is complete. Yes.